In this video lesson, I would like to demonstrate a very effective, a very powerful method for working into the myofascial tissue in the interscapular region between the scapula and the other scapula, more specifically between the scapula and the spine. And we're going to do this with our client Anya lying prone. And what I'm going to do is demonstrate it for the right side. I'm going to take my right knee and place it up on the table underneath her shoulder girdle, and then assuming the client is comfortable with their glenohumeral shoulder joint and they can put their hand in the small of their back, we can perform this technique. So by me putting my knee underneath her shoulder girdle, it brings her shoulder girdle, her scapula, back into retraction, which slackens all of the musculature and soft tissue generally between the scapula and the spine. This means that the middle trap and the rhomboids, being retractors, are shortened, they're passive, they're slackened. And we also see that the scapula medial border is open here, and I can reach around to grab and hook around deep to it toward the anterior side. We're going to do this with reinforced finger pads. Here's one hand to see, but when we reinforce it will be like this. That will give us more power, more strength here, more stability. And as my finger pads, my fingertips to pads reach in, let's look at the tissue we're accessing. The skin, the superficial fascia, middle trapezius, rhomboids. Then as we reach around, we'll be getting towards serratus anterior, attaching on the anterior side medial border. And if we can reach around even more toward the subscapular anterior surface of the scapula, we would actually be pressing into subscapularis. So I have this position here. Anya, take a breath in and relax and breathe out. And all I need to do is lean back with body weight and just press in with my finger pads. Take a breath in and breathe out and just lean back with body weight. This is a very effective means of leveraging my body weight. Breath in and breath out. And just sinking in with my fingertips, my finger pads, deep to the scapula. One more time, breath in and let it out. There we go. Now, a couple of things about this technique. Some clients are so adhesed in this area that even in this position, you cannot grab, hook around to get to the other side of the scapula. For those clients, more preparatory work must be done to be able to loosen this tissue, to be able to perform this technique. The other thing is we're somewhat leading with fingertips. So if our fingernails are a bit long and or they're a bit sharp, we might want to blunt that with a nice thin piece of cloth. Further, if we've just been massaging the person and there's some type of lotion here and we're slipping, then we would need to get friction, and again, that cloth could do it. So I have here a thin face cradle cover, and I can just place it there, and it gives me a little more grab in here, and it blunts my fingernails, as I said. Take a breath in, and let it all the way out and relax. And I can just lean back. A little bit of movement is always a nice idea whenever you're doing a deeper technique. Okay. And relax there. So that is a technique with the client prone for reaching around toward the anterior side of the myofascial tissue of the shoulder girdle in back, of the scapula in back.